Greetings, gentlemen and ladies. Welcome back to our series of lectures on principles, introductory principles in pharmacology. And we are looking at pharmacokinetics as a branch of pharmacology, the study of how drugs move in the body. Pharmacokinetics, if you remember, in terms of explaining, we have explained that pharmacokinetics really is a study of the processes that affect the drug in the body. So basically is what the body does to the drug. But a definition is a technical description of the process. Okay? In this case, the branch of pharmacology technically defining it. And if we say define or explain, those are different objectives. So when we say you should explain, you are just trying to tell us what you know about the process. When we say define, we want you to memorize the exact or close to the technical components of what pharmacokinetics is in this case. So I will emphasize that pharmacokinetics as an explanation is really what is happening to the drug as it is administered to the body. That is an explanation. That's what we understand in simple terms. But what is the definition of pharmacokinetics? Pharmacokinetics is the quantitative study. So it is measured. It's the quantitative study of drug absorption, distribution, metabolism, and excretion, and the mathematical relationships amongst these processes. That is it, the definition of pharmacokinetics is the quantitative study of drug absorption, distribution, metabolism, and excretion, and the mathematical relationships that exist amongst these processes. So, if you were missing mathematics or pharmaceutical calculations, it's coming back, and here we'll be calculating half-life, we'll be calculating doses, we'll be calculating plasma concentrations, we'll be calculating bioavailability and all those things. So this knowledge is very, very important in helping professionals to adjust the doses for the individual patients or animals in as far as the administration of drugs are concerned. According to what? It could be according to the size of the body weight, fluid composition, the function of the liver or vital organs, the circulatory system, and all those things. So, pharmacokinetics is very, very important. The three most important pharmacokinetic parameters. So, pharmacokinetics, remember we have said, is the quantitative study. So what components do we use to quantify what is going on, to measure what is going on, is what we call pharmacokinetic parameters. What we call pharmacokinetic components, these are the branches of pharmacokinetics. What are the branches or processes of pharmacokinetics? Is absorption, distribution, metabolism, and excretion. ADME or ANDME sounds Tongish. So ADME, those are the branches of pharmacokinetics or the sub-branches or the processes of pharmacokinetics. But the quantities, the parameters, the components we use to measure what is going on in absorption, distribution, metabolism, excretion, those we call them pharmacokinetic parameters. So if we asked you, what are the pharmacokinetic components? These are the processes of pharmacokinetics: absorption, distribution, metabolism, excretion. But what are the parameters? These are the variables. These are the components of pharmacokinetics processes that we measure to quantify what is going on with the drug. So what are these? One, In measuring what is going on, to what extent absorption has taken place, we will measure the portion of what is administered and reaches what? The blood. What portion of what we administered has reached blood? That is bioavailability. So, when we administer a dose, the amount that we have administered of the drug, we will check what portion, what ratio, what percentage has reached the blood. That is what? Bioavailability. Then in terms of volume of in terms of distribution, we are going to measure if we have a dose, we have 20 milligrams, and then we want to produce 20 milligrams per liter as the concentration that should be enough to correct the problem in the body or enough to clear the infection. Then what amount of water in the body should dissolve that dose? That is called volume of distribution. In other words, we are saying what is the amount of water in the body is accommodating or dissolving the drug. And we will use this volume of distribution to determine, is this drug only dissolving in the plasma or it is dissolving throughout the body? If it is just dissolving in the plasma, then we will know that this drug does not escape the blood. When it reaches the blood, it remains there. So if we want to do any correction, maybe there is toxicity, all we need to do is to clean the blood. But if we discover and we calculate the volume of water in the body that is dissolving the drug is more than the plasma, then it means that the drug is dissolving also in other fluid compartments. Therefore, the volume of distribution is very large. Therefore, if there is toxicity, we don't need to just filter the blood or clean the blood. We need to maybe just give an antidote, because the blood is not the only compartment where the drug is distributed. So that is very, very important. Then, what about metabolism and elimination? What parameter do we use to measure that? We use clearance. And clearance is that if we have the volume that has dissolved the drug is 20 liters, to what extent, or close that door please, to what extent, how much volume of this, how much volume of this, of the volume of distribution, how much of the volume of drug that contains the drug, how much of the volume in the body is completely cleared of the drug per unit time. So if we had the drug dissolving in 10 liters of the total body water, and per minute we are clearing only 1 liter of that, then it means that the clearance is very low. But if we come and check after some time, out of the 20 liters, we have cleared within 30 minutes 80% of it, then it means the clearance of the drug is very high. Okay, so pharmacokinetics can be quantified by using parameters: bioavailability, volume of distribution, and clearance. Then we also have derived parameters like half-life. Half-life is the time it takes to reduce the initial concentration that you produced in the body to half. So if you are taking a short time to reduce, if the concentration, for example, we reached after administering the dose is 20 liters per 20 grams per liter, and we reduce that to 10 grams per liter within 1 hour. Another drug takes maybe 5 hours to reduce its concentration to half. Then it means the first drug has a short half-life, meaning it is not staying longer in the body. So all these parameters are very, very important in describing pharmacokinetics of a drug. So when we are describing the pharmacokinetic profile of a drug, we will describe its bioavailability, we'll describe its volume of distribution, we'll describe its clearance and its half-life. So these are very, very important. So we'll be calculating these things and you have fun. We will have bioavailability being calculated, we will have volume of distribution being calculated, we will have the clearance and the half-life being calculated. So in continuing with this discussion, we are saying absorption is very, very important and is the passage of the drug through body barriers from where we have administered into blood, so that now from blood it can move to the target sites for action. And the major mechanism by which these drugs move from the site of administration into blood is by diffusion. And diffusion, remember, it is the movement of a chemical substance from one side of the barrier to another because of the concentration difference. And so we have to know. Okay, so diffusion is the most important mechanism by which drugs get absorbed and distributed in the body. So then, all the processes that affect diffusion will affect absorption. What are the factors that affect diffusion? The size of the molecule, whether the drug is lipophilic or it is hydrophilic, whether this drug can ionize or it can remain unionized. Okay, so we are talking about issues of pKa, we are talking about issues of pH and things like that. Those you have done in chemistry. So the pKa of a drug, which is the pH at which the drug is half ionized and half unionized, is very important because at this level we expect that the drug will have maximal absorption, because the major component of absorption for ionized drugs will be what? In the unionized states. What is the significance of pKa? So we'll find that the pH of the body affects diffusion of drugs across cell membranes. Why? Because we find that the unionized ones will be more absorbed, and the ionized ones will not be lipophilic, so they will be repelled by the plasma membranes of the barriers. So then we expect that acidic drugs will be unionized in acidic medium, so they will be absorbed more in acidic medium. Basic drugs will be unionized in basic medium, so they will be more absorbed in basic medium. Also, the issue of pH. If there is toxicity of a certain drug in the body and we want to reduce its concentration in the body, all that we need to do is increase its ionization so that the drug cannot be reabsorbed highly by the kidneys. So because of that, then we have to increase. If it's a basic drug, we try and change the blood so that there is high ionization. If it is slightly acidic, we try and alkalinize the blood so that we ionize most of it and reduce its reabsorption by the kidneys. And so we have examples of how drug toxicities are corrected. We can talk about poisoning of salicylates and those ones. Okay, so we will talk about bioavailability in the next lecture, and then we will look at how is it calculated. Yeah, otherwise we can end here.